Now, before we continue, or before we start, sorry, any questions? Have you guys been receiving the materials?
Yeah.
Okay.
Um, I think I had a question. Let me just double check real quick. Can you refresh my memory on what the vasa vasorum is exactly? I know I wrote down it's a blood vessel that supplies blood vessels with blood, but I'm not really
That's what it
understanding.
is.
Like blood vessels need blood vessels to supply them.
Yeah.
Okay.
And those will be what you call vasovasorum. Okay. Okay, my dear, just think of it in this way. Blood flowing through the heart, for instance, through the chambers of the heart, atrium, ventricles, and things like that. Okay. That blood is not going to do any good, any benefit to the heart in the sense that, okay, it's not going to deliver oxygen, nutrients, goodies, etc., to the myocardium. Did that make sense?
Mm-hmm.
Right. Okay. So that's why it's okay. Your heart has its own circulation of blood called the coronary circulation. Did you get that?
Yeah.
Okay. Now, likewise, if you look at, okay, as the number as, okay, the pattern of layers in the heart and the patterns of layers in your blood vessels, what do you see? What we in the heart call endocardium, and the blood vessel we call it intima or tunica intima. Okay. Then we had the myocardium. Equivalent to that in the blood vessels was tunica media, which was mainly made up of muscles. Okay. But in the heart, you had cardiac muscles. In the blood vessels, we had smooth muscles. Did that make sense? Okay. Then in the heart or in the myocardium, we said epicardium. In the blood vessel, we call that a similar layer, tunica adventitia. Okay. Now, because the heart had, not heart, because the blood vessel has layers of muscles that will need energy, oxygen, etc., etc. Okay. Those things are going to be brought to the muscles of the blood vessel via blood, but not blood that runs directly in the lumen of the vessel. So that's actually going to be blood vessel that supplies the wall of the blood vessel, and those are what you call vasors. Did that make sense?
Yeah.
Good. Okay. And where do they run? Between the tunica adventitia and the tunica media.
Okay.
So simple as that.
Thank you. I had one more. Did you say that there's cilia in the fallopian tubes that push the egg towards the uterus, or
You
no?
can put it that way, yes.
Okay.
I had two questions as well.
Okay.
Um, okay, so I know you said the common carotid arteries branch off from the right internal and the left internal. So is it branching off to
No. No. Your right and left main carotid arteries. Okay.
Mhm.
Now, you're talking carotid or coronary?
Carotid?
Carotid. Okay. Good. Okay. We had a common carotid. We have a common carotid on the right. We have a common carotid on the left.
Okay.
Does that make sense? Clear? Okay. The only thing that in which they differ is the way that they originate. Your right common carotid is going to originate off from the brachiocephalic trunk, which branches off the arch of the aorta. Did that make sense?
Yes, but when they branch to the internal and external,
Yeah.
are they branching? So is it branching to right internal and I mean sorry, right internal, right external?
Okay. Let me go. Let's do it this way. Now, this was your arch of aorta, right? Okay. Just so you know what we're talking about, this is the right side. This is the left side. Now, what did we have on the right side first was the first branch that arches off the arch of the aorta is going to be the brachiocephalic trunk. Okay. Now, what we said the other day was that this is going to give off two branches primarily. The right subclavian artery and the right common carotid artery. Then we have the left common carotid artery. Did you get that?
Yes.
Okay. Now, what happened to both of these, whether it's the right common carotid artery or the left common carotid artery, is going to be the exactly same. So we can mainly say that the right common carotid artery is going to branch off into the internal carotid artery and external carotid artery. But since both of these are on the right side, they're going to the right. But the same is okay. Your left common carotid is going to go undergo the same treatment. So they're going to be okay an internal carotid artery, and that's going to be okay an external carotid artery. But saying yes, okay, this is off the left common carotid, this is going to be this, your left internal carotid artery and your left external carotid artery. Okay, so the only thing that differed between the right common carotid and the left common carotid was their origins. After that, that's okay, they go under the same treatment. Was that what you asked?
Yes, that makes sense. So basically, they're branching off these common carotid arteries into four because it's the external right, the external left, the internal right, the internal left.
Yeah.
Okay. Okay, that makes sense. And then I did just have one other question.
Mhm.
So the basilar artery,
Mhm.
does that bifurcate into the two posterior cerebral arteries?
You can put it that way, yes.
Okay. Right. Thank you.
So following up on that, when you said the internal carotid artery gives off two branches, the anterior cerebral and the middle cerebral, it'll be the same for both the right and the left side?
Yes.
Okay. And
So what is this going to do further? Inside the cranial cavity is going to give off anterior cerebral and middle cerebral. So what's this one? Anterior cerebral and middle cerebral. And your anterior cerebrals are going to be connected together via what we call the anterior communicating artery. Did that make sense?
it did, yeah.
Okay.
But the posterior cerebral artery is not a branch from the internal carotid, correct?
No.
Okay.
That comes off the, and that's why I mean it's okay, divided into two systems and broke it up. Because we had, okay, let me just take it to another slide. We had our subclavian arteries, right? Okay. Now, what did they do? They gave off what we call the vertebral arteries. So that's okay. You can say from right and left vertebral arteries. Okay. Now, this right and left vertebral artery is okay. Respectively, is okay coming off from the right subclavian and left subclavian artery. Pass through foramen magnum, and as soon as they do that, they unite and become, yes, okay. Now let's become, yes, okay, what we call the basilar artery. Okay, which mainly was going to, yes, okay, to run anterior to the pons, a structure in your brainstem, and hence going to give off pontine arteries. Now, what we then said was that ultimately this is going to branch like this into what we'll call the posterior cerebral arteries. Yeah, okay. On the right and on the left. Now up here, did we for instance have, just okay, the middle cerebral arteries. And we had the anterior cerebral arteries. Now, between the middle cerebral arteries and the posterior cerebral arteries are going to be these two branches here, which will be called the posterior communicating artery. And between, it's okay, your right and left anterior right and left anterior cerebral arteries is going to be the anterior communicating artery. So this whole network here is our circular villus. Okay, but there was two separate, if you want to put it that way, okay, contributors of blood vessels, or set of blood vessels that contribute to form the circular villus. One coming off from your subclavian arteries, one coming up from your carotid arteries. Or more specifically, internal carotid, which comes off, yes, okay. On the right side, yes, okay, brachiocephalic trunk, also like common carotid, which on the right came off the brachiocephalic trunk, and on the left, it's okay. Same, okay. Because it's okay. Internal carotid, which came off the common carotid, which came off part of the aorta.
So would it be the internal carotid and the vertebral arteries that like are the main
Pretty
arteries
much.
that are
Pretty much.
forming it?
Yeah.
Okay. And then where do the communicating ones branch off? The
What do you
communicating
mean?
arteries. Like, do they come off the carotid or the
No,
vertebral?
they're just going to be vessels that form a bridge.
Okay,
Form a bridge.
thank you.
Anybody else? Okay, guys. So let's talk about the blood supply of our lower extremity. Or if you don't like to call it a lower extremity, you can call it the lower limb. And let's just start from the beginning. We have the heart. And okay, guys, just to when we said supply, that supply of blood is going to be arterial. So arterial supply of the lower extremity. Okay, now from the heart, do we have the aorta? First part was thoracic aorta. Passes through diaphragm. Become abdominal aorta. Yeah, okay. We talked about, yes, okay, it's branches and so on, so on. So yesterday, where we know that at the level of lumbar vertebra L4, our abdominal aorta is going to, yes, okay, bifurcate into or will come the, yes, okay, sorry, the left and the right common iliac arteries. Or what we also can call it, okay, CIA. Now, guys, if you recall from yes, okay, the common carotid arteries, what did we have? And mainly because that's okay that it used the word common. We says okay, it was going to branch into two in the instance of the carotid. And mainly as okay, the term carotid artery was going to as okay be carried on. So likewise, guys, both of your iliac arteries are going to undergo the same treatment. So it's going to give off two branches each. And let's do it this way. Now these here are going to be the internal iliac artery. And of course, that's okay. This is going to be the left one. This is going to be the right. No, sorry. Right and left. Likewise, we can say that these are going to be the external iliac arteries. As of course, the right and the left. Did you guys get that? Okay. So off your aorta splits into two, right common iliac artery and left common iliac artery. But each common iliac artery is going to pretty much undergo the same treatment. So each common iliac artery is going to split into two again. Each common iliac artery is going to split into two, giving off what you can call it, okay, the external iliac artery and the internal iliac arteries. Just like your common carotid on both sides splits into two and becomes the internal carotid and the external carotid. Did you guys get that? Now, guys, your internal carotid, no, I'm sorry, not carotid, sorry. Your internal iliac arteries. Okay, now they are mainly as okay going to be responsible to supply blood to the pelvic structures. Okay, you can say mainly as okay, whatever's left of the rectum anal canal, anus. Okay. Your bladder, urethra, floor of the pelvis, and all that. Okay. And then the female things such as, that's okay, your uterus, the vagina, etc., etc. All those structures are going to be supplied by branches of your internal iliac arteries. Did you guys get that?
Yeah.
Whereas, now hopefully it's okay, you got 2 legs. So what mainly is okay is going to end up supplying blood to your legs or your lower extremities is going to be the continuation of your external iliac artery. So you can maybe it's okay, just take one external iliac artery here, for an example. Okay. So this is still yes, okay, in your pelvis. Now we all know that, okay, yes, we have, okay, yes, the inguinal ligament, and or in the males, or we have what you can call the inguinal canal, through which is, okay, the testicular blood vessels and the spermatic cord is going to be running. Now, whether it's a male or whether it's a female, we can say it's okay. First thing that we have inferior to that is going to be, it's okay, the thigh. Right. Now, the technical word for thigh or thigh is going to be femur. Now, as this external iliac artery, it's okay, passes down behind, it's okay, the inguinal ligament, and enters into, it's okay, pretty much okay, the anterior medial side of your thigh. Okay, that means it's okay, a triangular region here. Which is going, now this triangular region here is going to be called the femoral triangle. So that's okay, the superior bar is going to be formed by your inguinal canal. Right? And the lateral border and medial border. Just so we know what we talk about. This is going to be okay. On lateral side, this is going to be the medial side. So over here is okay, you will have had another thigh, for instance. And in between will be your perineum. Well, what do we call the artery in this region here? Artery mainly as okay, just changes its name and becomes the femoral artery. Okay. Some people may like to call it the common femoral artery. Now, what we mainly as okay have in this femoral triangle here is also going to be as okay a nerve. We just call it okay the femoral nerve. And medial to the femoral artery is going to be as okay vein that we just call the femoral vein. Okay. So yes, okay, that's your relationship between the structures in your femoral triangle. So going lateral or going medially to lateral. That's okay. It becomes band. It will go from medial laterally. It becomes band. I will go here. I've been a nerve. People have had an artery. And medial is okay. What had been a vein. So going from the medial side to the lateral side, the arrangement on the relations is when. Okay. Now, guys, this artery vein, yes, okay. Now, as I said, yes, okay, this femoral triangle here is on the anterior medial side. So, do you guys mind if I go to another slide?
No.
Okay. So, if you look at it like this, so it's okay. Okay, yes, apply. Okay, that's whatever you have in your coin. But anterior medial. That's going to be as okay where you have the femoral triangle. You can mean it's okay up here. It's okay. That's what you have. Okay, it's your kneecap. Now, guys, your femoral artery. It's mean that's okay going to be a long artery. That means that's okay continues down. It runs down on the medial side of your thigh, anteriorly. Okay. If we look at it and says, okay, this was a hip. We can say, okay. If this, for instance, okay, was your thigh. And here, we're going to have just, okay, the bone in the thigh. That's okay, called the, what do you call the bone in the thigh?
The femur.
The femur. So literally we can say it's okay that your common iliac artery, no, sorry, the femoral artery runs like this on the anterior medial side down like your thigh. Okay. Now, guys, what it may do in the initial of its origin or of its course. is going to give off this branch here, which can be called the deep femoral artery. Yeah, okay. Now we could call it the deep femoral artery, just like as in your upper extremity, we had an artery called the deep brachial artery. But that deep brachial artery could also be referred to as the profunda brachii. So this artery here may also be known as profunda femori or profunda femoral artery, whichever. Did that make sense? Okay. Did you guys get that? So that's okay, your femoral artery. Here's all just okay, a branch. And mainly that's okay is going to run laterally called the deep femoral artery. Now what this fellow here is okay will do is mainly it's okay give off two branches. One is going to be referred to as okay as the lateral circumflex artery. Now some people yes okay may yes okay just to specify it yes okay put the word femoral in. Whereas another branch that is going to give off is going to be the medial circumflex artery. And some people may even as okay pour in the word femoral. Okay. And what are these two fellows going to do? Pretty much okay the same as our anterior humeral circumflex artery and posterior humeral circumflex artery did. Form this anastomotic network around the neck of the femur. Did you guys get that? Okay. And why is this anastomotic network here so okay we can say going to be important, clinically important? This is a common area of fracture of the femur. So yes, okay, what can happen? Damage to, yes, okay, this anastomotic network here. Did you guys get that?
I'm sorry, what is it called again?
What do you mean, what is it called? It's an anastomotic network of two circumflex arteries, right? Because what I said was that, okay, ultimately it's okay, these two blood vessels here, whether it was the medial circumflex femoral artery and the lateral circumflex femoral artery, they're going to meet end to end. And what do you call when two tubular structures meet? Most likely it's okay, end to end. The anastomose. Okay. But this area of the femur is also as okay a common site of fracture. Okay. So it's okay. What may, it's okay, what very likely may happen is due to it's okay, the breaking point is okay, these blood vessels here is okay, may get damaged. Okay. Any questions? Sure. So just like your brachial artery ran on the medial side of your upper arm, femoral artery run down on the anterior medial side of your thighs. Just like your brachial artery gave off a branch called the deep femoral brachial artery of brachia of profunda brachii. Likewise does your femoral artery gives off a lateral branch known as the deep femoral artery or the profunda femori. Did that make sense? Okay, guys. So this is going to be your femoral artery. Now down here, at this point here, it's okay. It's going to be, it's okay, what we'll call an adductor hiatus. Okay. Now what is that this adductor hiatus is? Mainly as okay, just a space between as okay, some of the big medial muscles in the thigh, which means it's okay, it would be adductor muscles. Right, so down here is okay, mainly because it's okay, you don't have muscle bulk, but it means it's okay, there's going to be the tendons from it's okay, these adductor muscles here. Okay, that will continue. So that actually is okay, this bigger, smaller area. And it's actually going to be through this adductor hiatus here that okay, as your femoral artery now will pass. Okay, and literally run posterior. onto the posterior side of your leg. But what we will have here? Well, there are going to be 2 bones. Or 3 bones, rather, sorry. Laterally will we have the bone that we call the fibula, right? Medially will be the bone known as what?
Tibia?
Huh?
The tibia?
Tibia. Okay. And then we had is okay, what we demonstrated here was okay as the kneecap. Or what was going to be the name of your kneecap?
Patella?
Patella. Okay. So running anteriorly, medially along the thigh. Ultimately, it's okay, the femoral artery passes through what we call the adductor hiatus and now runs posteriorly. So after that, let's do it this way. We said what we started off with was common iliac arteries. Okay. Common iliac gave off internal iliac and external iliac. External iliac is okay. When it runs into is okay, what we call the femoral triangle. Its name changes from the external iliac to become the femoral artery. The femoral artery runs down, yes, okay, your thigh, pass through adductor canal, or hiatus, sorry. And now runs posterior, and this part here is now going to be called the popliteal artery.
Did you say it changes to that popliteal artery,
It just
or
becomes the popliteal artery, exactly.
becomes it?
Yeah. Okay. So the popliteal artery, what is that going to be? Running posterior to your knee. So if you just take, okay, as a side view of the knee. Do you mind if I go to another slide? You can always come back here. If we say it's okay, this here is okay as your patella or the kneecap. Okay. We can say it's okay up here is the femur. Let's just say it's okay that we are looking from the medial side, so we can say it's okay. This would be it's okay the tibia. Okay. Up here, that's okay. It was the femoral artery. Passes through, yes, okay, the adductor hiatus. The femoral artery passes through the adductor hiatus, and pretty much okay as it do so. Well, okay, physically, it's the same vessel that continues, but now it just goes under another name. And now it's going to be called the popliteal artery. Did that make sense? So your popliteal artery, that's mean it's okay going to be running posterior to your knee joint. Did you guys get that? Okay. So mainly that's okay. If you're sitting down, well, okay. Right now it's okay. The anatomy is like this. It's going to be the femur. You can mainly say it's okay. Okay, it's something like this would be a tibia, and it's okay. Here you can say it's okay. You have your kneecap. So popliteal artery is going to be running here. Okay. Now, if we just says okay again, it's okay. Look at the front, because we said we had the femur. Just so we know those sides. Sorry. Lateral and medial. Okay. You can see. Then we had our femoral artery. Passes through adductor hiatus. And as okay as it passes through the adductor hiatus, it's going to just okay change its name and become the popliteal artery. Okay. Now maybe that's okay, just okay, make clear what we are talking about. We're just going to, let's say, remove or take as okay the patella or the kneecap out of the picture. Or we can mean it says okay, medially it's okay. What do we have? This big bone here that we call the tibia. And laterally is going to be the fibula. Did you guys get that? Okay. And all this is okay. popliteal artery. Mainly as okay, runs posterior to your knee. Now, guys, let's choose a line. Because in between the tibia and the fibula, did we have a membrane, right? And what would you call that? What we will call this membrane that extends between the tibia and the fibula.
Was it the interfossa? No.
Nah,
No?
okay, let me help you out, Vicky. The inter part is correct. Fossa, my dear, fossa is mainly going to be a located name for a dip or a ditch region, so can't be that. Why it's called inter something.
Is it intercossus? Cossus?
Huh?
Intercossus? I don't know how to say it.
Intercossus? Nope.
How about enterosis?
Huh?
Enterosis? Remember?
Interosus. Membrane. Good job, Michelle. Just like in our upper extremity between the radius and ulna. Didn't I say that we had a membrane that was called interosseous membrane?
Mhm.
Now, some of you may start getting a headache and say, okay, oh shit, is it that action repeat again that we have from the upper extremity? No. Yeah, it's pretty simple. Okay, guys? Clear? Okay. So what your popliteal artery is going to do, mean that's okay. Because it's okay to travel towards that. But ultimately, it's okay, just give off two terminal branches here. One is going to be running posteriorly, or continuous, okay, posterior to the interosseous membrane. And this is actually going to be what we'll call the posterior tibial artery. Another branch, or let's say it's okay, terminal branch of your popliteal artery is going to run anterior to the interosseous membrane. And we just will call that, what do you think this one will be called?
Anterior
Yeah.
tibial artery?
Anterior tibial artery. Did you guys get that? Okay. Now pretty much occurs by its end, this posterior tibial artery. Yes, okay, will give off a branch that means yes, okay, it runs laterally. Okay. And that's going to be referred to as, I mean, yes, okay, after the bone that we have on the lateral side. So that's going to be the fibular artery. Okay. Now this fibular artery, sorry, ladies and the gentlemen, this fibular artery may also be known as the peroneal artery. So the fibular artery, which is a lateral branch of your posterior tibial artery, may also be known as the peroneal artery. Did you guys get that? Now, guys, please. Okay. I mean, yes, okay, I draw it this way, but how it literally is. IVC. Let's just go to the next slide. IVC. This is the tibia. And just so you guys know, okay, we can still draw this, okay, or fibula. You can see we have the anterior interosseous membrane. And anterior to that is going to be the anterior tibial artery, and posterior to our interosseous membrane is going to be the posterior tibial artery. Which down here is okay, gives off a branch called the fibular artery, also known as the peroneal artery. But ladies and the gentlemen, down by your, you can say, ankle. Now, if you just look at the medial side of your ankle. So this was the tibia. Okay. Now, just so you guys know what we are talking about, this is going to be anterior. This is going to be, it's okay, posterior side of the tibia. And right now, yes, okay, we're looking at the medial side of the tibia. So down by the ankle, your tibia medius, okay, ends in this big bony protuberance, which we call the medial malleolus. Now, guys, if you remember when we were talking about the ankle, I asked you guys to make sure that you know that this will be the medial malleolus. As a matter of fact, that's okay. From the lower end of your fibula, it's okay, it's going to be a similar structure, also called the malleolus, but meaning it's okay because that's your fibula is on the lateral side, that's going to be your lateral malleolus. So what we mainly will have is okay, posterior here. Posterior to the medial malleolus. That's going to be as okay where your posterior tibial artery will run. Okay. But it's going to be as okay important at the posterior side of the medial malleolus, because this is going to be as okay a point where it's okay this posterior tibial artery actually is okay will give a pulse. So you'll be able to feel the pulse of the posterior tibial artery. Did that make sense? And what does a pulse feel like? Now, if you don't feel a pulse in the posterior tibial artery, what could that mean?
There's no blood flow to the legs.
There's no blood flow to the posterior tibial artery. That would mainly mean that, okay, the blood flow is blocked somewhere at a higher level. So then you may go and yes, okay, try to feel for the popliteal artery. If you don't feel any pulse in the popliteal artery either, oops, then you may have to go for the femoral artery pulse. Clear? If you find a pulse in the femoral artery, you can say, okay, at least blood reaches to the femoral artery, but there's a blockage between the femoral artery and the popliteal artery. Did that make sense? So it's nearly rocket science. You just have to just okay understand the anatomy. Or just think of a road. Or okay, you're going southbound, and okay, you mainly see as okay that the northbound area or northbound lines on the highway, that's okay, there are close to no cars coming. You may say, well, okay, either people are traveling in this direction right now, or there may be as okay a big traffic block further up. Right? And when you travel further, yes, okay, it comes, yes, okay, your nightmare is true, comes true because yes, okay, there's a big blockage on the highway. 16 fire trucks trying to, yes, okay, extinguish a non-existent fire from the collision of one car. And just, okay, the side fence rating or whatever. Okay, so that's pretty much it. So that's going to be, okay, a pulse that you'll be able to feel of the posterior tibial artery, which is going to be posterior to the medial malleolus. All the medial malleolus means it's, okay, that terminal bony protuberance on the medial side of your tibia. Okay. Now, on the other hand, guys, we also said, okay, yes, what did we have here? A running anterior was going to be, okay, what we call the anterior tibial artery. Of course, yes, okay, this posterior tibial artery is going to, yes, okay, you can just, okay, continue into, yes, okay, the sole of your foot and so on. So I'll give up plantar branches and all that, but we're not going to talk about those. Okay. They are going to be, as okay, we can say it's okay, too small to be, as okay, visualized by regular ultrasound probes. Now, ladies and gentlemen, your anterior tibial artery. Now, what do you have here? We can make, okay, of course, it's okay, we will have, let's say, it's okay, our, what the hell do we call those? Tarsal bones, sorry. Okay, yeah, okay, it's the tarsal bones. You have, okay, it's a big tarsal bone here, right? Calcaneus, which was your heel bone. As a matter of fact, guys, okay, let's do it this way. So, which is, okay, the heel bone or the calcaneus. And here's, okay, was the medial malleolus. And what we know is that there's a big tendon from your calf muscles that we call the Achilles tendon. And we can mean it as, okay, is going to be in this region here that we feel the posterior tibial arterial pulse. But we can say, it's okay, we have the tarsal bones. We will have the metatarsal bones. And then we will just, okay, have our phalanges of the toes. And now on this surface here, maybe as well get the surface of your feet that you look at if you're standing up, and that's okay, looking down. Rather here. The anterior tibial artery is going to continue and mainly as, okay, become what we will call at this point here the dorsalis pedis artery. And guys, why in the where I mentioned this? because this is going to be another pulse, another artery in your foot where you will be able to feel a pulse. Okay. To be more, yes, okay, diagrammatically connect. Let's see, this is the foot. We can mean says, okay, here that will be, yes, okay, where we have our other, yes, okay, a big other carpal bone that we call the talus. But onto that, yes, okay, did we have our metatarsals. And just so you guys know what the blue we are talking of, this is going to be the medial side. This is going to be the lateral side. And after the metatarsals, yes, okay, do we have the tarsals? So this is going to be, yes, okay, your big toe. So the big toe. And we can mainly says, okay, pretty much okay, the point where the metatarsal in the line from your big toe meets the talus bone. This is going to be, okay, where you'll feel the pulse of the dorsalis pedis. Now, some of you will say, it's okay, dorsalis, doesn't that come from dorsal, which means behind? So this will be the dorsum of my hand, or the back side of my hand if I'm standing in the anatomical position, right? So what would this surface be then? The anterior surface of my hand, or more, that's okay, correctly when I'm referring to the hand, is going to be, what do you call the surface here? OMG.
Wait, can you repeat that?
No.
Palm.
Huh?
Palm.
Your palm. Did that make sense? People goes crazy about the lines on these hands here, right? Okay. It's not correct. Okay. Whereas, okay, people, okay, so okay. Palm reading and all that. Okay. Or palmistry as they may call it. Okay. Now, on your foot, we had what you can call the sole. What was the name for the sole?
Cal. Is it calcancus?
No.
No.
Sole.
Is it plantar?
Plantar, exactly. Plantar. Right. Okay. Okay. And opposite to that is that's going to be dorsal. So that's okay. Palm and plantar, PP. And then opposite to plantar and palmar is going to be dorsal. Okay. Or you can look at it in that way that, okay, yes, the surface of your hands and the surface of your feet where you are able to just, okay, establish a good grip. another thing that you are holding on to or walking on. Other surfaces start with P, and the opposite sides would be dorsal. Okay, so if you are standing up in the anatomical position and looking down at your feet, the surface that you will see that, okay, although it's okay, face up, is going to be the dorsal surface. Okay, so that artery that you may feel is okay on the dorsal surface of your feet, right here, meaning that's okay where the metatarsal for your first toe, or that's going to just okay lead to your first toe, meets with the talus. That's going to be as okay where you will feel the pulse of your dorsalis pedis. But this dorsalis pedis artery here, mainly as okay, was just a continuation of the anterior tibial artery. So ladies and gentlemen, from the beginning, if we said that we had the aorta, it splits into common iliac arteries. And I'm just going to carry on one side, which is going to give off the internal iliac artery and external iliac artery. This external iliac artery passes under inguinal ligament and become the femoral artery. I think when you go for a scanning, yes, okay, your teacher most likely is okay, would like to call this the common femoral artery. This is going to, yes, okay, be running medially, yes, okay, to your femur. And in the beginning of its course is going to give off a deep femoral artery. This deep femoral artery gives off two branches which will anastomose, respectively being as okay the sorry, medial circumflex and the lateral circumflex. And you can say it's okay, femoral artery, femoral artery. Just to, yes, okay, create some room. We can say it's okay that this femoral artery is okay, passes through what we call the adductor hiatus and now runs posterior to the knee, where we will refer to as the popliteal artery. We can say, choose okay, yes, the interosseous membrane is going to, yes, okay. This popliteal is going to split and give off the anterior tibial artery. A big juicy fellow. The main, yes, okay, is going to run down on the anterior surface of the tibia on the medial side. And it's going to give off a posterior tibial artery. This posterior tibial artery is okay, will mainly is okay run posterior to the medial malleolus. Which is okay as a distal protuberance of the tibia. Whereas the anterior tibial artery continues and in the foot becomes the dorsalis pedis artery. I almost forgot. But this posterior tibial artery will also give off a branch which will be what we call the tubular artery, also known as the peroneal artery.
What does that say in the parentheses in the yellow? The distal,
Protuberance of your tibia. What we mean by protuberance is there's going to be a big bony structure.
and that's where the pulse,
So
you can feel
posterior
the
to that
pulse.
is going to be your posterior tibial artery.
Okay, and you can feel the pulse in the
Pulse.
medial malleus,
No,
right?
not in the medial malleolus. You'll feel the pulse of the posterior tibial artery, which runs posterior to the medial malleolus.
Okay.
So no worries, guys. In your next program, my job will make sure that you'll be able to feel, if not all, most of the arteries, arterial pulses. Or at least know where to feel for them, okay? Any questions? So this was the arterial supply of your lower limb or lower extremity. Any questions?
I have a question. Should we
Yes,
be
ma'am.
focusing more on studying the like? Should we be more focused on a diagram of where where the arteries are going to be, or just where they articulate from, or go from, branch off from? Because this is so much information, I don't even know how to study because
Yeah,
it's just a
I
ton of
agree.
information.
Yeah. And in terms of like all this we just finished learning in this week, I mean, is this gonna be like a lot on the final compared to like all of our pre?
Any questions? Nope. Now, guys, if you go venous drainage of the lower extremity. Now, the first day when we talked about comparison of arteries versus veins, I said that we had two sets of veins. One was going to be okay, what we will call the deep veins. Right, okay. Which mainly is okay, as you could see, is okay, will run parallel, or if you want to say it's okay, side by side to the arteries. And if we say femoral artery, we will say femoral vein. We say popliteal artery, we say popliteal vein. Etc., etc., etc. Clear? Did you guys get that? Okay. And these deep veins here, is okay, were also, yes, okay, we could also call them vena comitatus. Now, guys, just like as okay in our upper extremity, it's okay, the lower extremity also have a set of superficial veins. Okay. And the superficial veins in the lower extremity. No. Nope. What the? Okay. Is actually known as the saphenous veins. Okay. But, okay. So the superficial veins in your lower extremity is going to be referred to as the saphenous veins. And pretty much, guys, it's okay, we will mainly have 2 saphenous veins. There's going to be one that she calls it's okay. Now some people may call it a short saphenous vein. Some people may as okay replace the word short by small. Okay. And our other saphenous vein is going to be as okay will be what some people call the long saphenous vein. Or some people may also press okay, change the word long by big or large. Did you guys get that? So there's relatively yes, okay, or that's practically going to be as okay. 2 saphenous veins in your lower extremity that makes up okay the superficial venous system. Now, guys, and that's for those who say it's a lot, because there's a lot of things that you may as okay can just copy and paste. Okay, guys. Now, what did we see in the upper extremity of the veins, or the venous drainage of the upper extremity? That ultimately, yes, okay, at some point, whichever superficial vein we had was going to empty into the deep vein, right? Okay. In the upper extremity, we say, yes, okay, the basilic vein will ultimately, yes, okay, drain into the brachial vein. The cephalic vein will drain into the axillary vein. Did you guys get that? And what were these axillary vein, brachial veins, axillary veins? They were all not okay, deep veins. Or vena comitatus, that means yes, okay, was just running side by side with the artery. So ultimately, at some point, yes, okay, whatever superficial vein you have will empty into the deep veins, going under the same name as okay as the neighboring artery. Did you guys get that? Okay. So guys, let us just okay. So here is okay. What do we have? Mainly is okay 2 veins. One which is going to be the short saphenous vein. One is going to be as okay the long saphenous vein. Now, if we just take a lower extremity, and some of you are going to say, "Hell, that's not my foot." Well, okay. Now we can mainly say it's okay. This structure here, guys, that's going to be your medial malleolus. Now, what we already said, that posterior to the medial malleolus, we have the posterior tibial artery. Okay. Further up, yes, okay, this posterior tibial artery. Let's see. Sorry. I probably took it a little bit too far up. Okay. Was going to be joined by what we call the anterior tibial artery and become, or mainly had become, yes, okay, what we call the popliteal artery. Did you guys get that? Okay. But what I would like you guys to realize is that side by side with this popliteal artery here, do we have a vena comitatus, which is going to be the popliteal vein, which we mainly can say, okay, is going to be as okay, deep vein, right? Right? Okay. This popliteal artery, if we just take, for instance, okay, the course of the artery, okay, will travel up anterior medially on the thigh as the femoral artery. Also, I had traveled down, right? Okay. Okay. All right, next to this is going to be your femoral vein. And ultimately, it's okay, what do? They is okay, can't, it's okay, enter into that, okay, yes, area that we call the femoral triangle. Did you guys get that? Okay, so this one mainly is okay, we can say, okay, your arteries along with their vena comitatus, or it's okay, the deep veins. Maybe mainly can say, okay, this femoral vein here is going to be, it's okay, a deep vein. Did you guys get that? Just what we just talked about, okay? So next to every artery is going to be, okay, an accompanying vein just with the same name. Did that make sense? Now, guys, let's talk the superficial veins. Of the lower extremity. And we mainly said that, okay, yes, these superficial veins, yes, okay, go under the name saphenous veins. The remaining is okay, are going to have two saphenous veins. One is going to be the short saphenous vein. And the other one is going to be the long saphenous vein. Now, guys, if we just draw, let's see, the foot. But this fellow here is okay, that's going to be your big toe, right? Now, what this fellow here is going to be, that's going to be your lateral malleolus. Okay. And what we mainly will see is that, okay, as the superficial, okay, your short saphenous vein, that's pretty much going to run posterior to the lateral malleolus. Okay. So we say it's okay. If we do it like this, say that this is the lateral malleolus. Then we will have, let's say it's okay over here, just two, yes, okay. What your short saphenous vein will do, run posterior to the lateral malleolus. And mainly it's okay, just empty into the popliteal artery. So short saphenous vein. What does it do? It's going to run posterior to the lateral malleolus. Okay. And we can mainly say, okay, now since it runs posterior to the lateral malleolus, it's going to run after that. We can say, okay, ascend on the posterior, which is going to be posterior, lateral side of the leg, and at the knee, by the knee, run and empty into the popliteal vein. So it pretty much okay as takes the short course and mainly it's okay empties into the popliteal vein. Over its course, lateral or posterior to the lateral malleolus. And okay, pretty much okay, proceeds up on the lateral side of your leg, but more or less okay towards the back, where ultimately it's okay, just finishes by emptying into the popliteal vein. Did you guys get that? Did you guys get that?
Yeah.
Summun Bukmun. Okay, ladies and the gentlemen, but not be as okay scared about the term long saphenous vein. Okay. No, but that's me as okay, I'm not going to use partly this diagram and then this, and then we can make okay, let's go over here. So your long saphenous vein. That's going to run on the anterior side of your medial malleolus. So it's going to run anterior to the medial malleolus. And pretty much, okay, it's up on the medial side of your leg. Likewise, just continue up on the medial side of your thigh. And in the femoral triangle. Empty into the femoral vein. So what can we say about the long saphenous vein? Is the long saphenous vein. What does it do? It runs anterior to the medial malleolus. Okay. And it ascends up on the medial side of your leg and thigh. And ultimately finishes by meeting, or we can say that's okay, draining into the femoral vein. And where was it that this femoral vein here was? That was a deep vein, or a vena comitatus. Right, okay. Here, this was the femoral vein. Right next to it, did we have the femoral artery? So into this femoral vein here, that's going to be okay where the long saphenous vein empties. Okay. So guys, mean is okay because it's a physically longer vein. That starts okay, it's all down, it's okay by your ankle. Tick, 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 runs this course. That's why we call it a long saphenous vein. Why was a short saphenous vein a short saphenous vein? That's mainly because it just took a shorter course, because it finished off by emptying into the popliteal vein, which was a vein right next to the popliteal artery behind your knee joint. Did you guys get that?
Will the popliteal vein eventually empty into the femoral vein?
Yes.
Okay.
Not
And
empty. No, not empty. It's just going to continue as the femoral vein.
okay. And are the saphenous veins, those are only in the lower extremity, not the
Yes.
top?
Yeah.
Okay.
Superficial veins. What do you mean superficial veins? Veins that you mean is okay, can see through the skin. The deep veins you can't see. Okay. Just like, okay, as the vein that you see on your hands, for instance, those are superficial veins. Right? The veins that you may see is okay up here when they take blood. Those are superficial veins. So what does it mean to be superficial? Close to the surface of the skin. What would be the opposite of superficial? Deep. Now, ladies and gentlemen, what's going to be the clinical importance of your saphenous veins? Now, a couple of things. You may come across people who have undergone open heart surgery. And most likely, it's okay. They may have used, okay, as what we call a venous graft to run that bypass. So that's mainly as okay where they will harvest a saphenous vein. Now, when I say harvest, they mean as okay, will mean as okay. Cut out, okay, as a bigger or smaller piece of the saphenous vein. Okay. Now, usually it's okay, the vein that they will go for to harvest for a coronary artery bypass is going to be the distal part of your your great saphenous vein. Okay. So usually that's okay. The area between the ankle and knee is okay. That person may have a bigger or smaller scar because it's okay. It's through that. It's okay that they will mean it's okay. Cut open up and it's okay. Okay, we need this many inches or so and so of the saphenous vein. I mean, it's okay. Take that out. Did you guys get that? So in some people, yes, okay, this may be missing. Did you guys get that?
Yeah.
Okay. But is that going to affect the venous return of the blood from the lower extremity? No, not really. Now, another thing that may be of, you can say, okay, clinical importance of your saphenous veins is that, okay, these are the veins that are mainly going to be likely to develop what we call varicose veins. Have any of you ever heard of varicose veins? Okay. That is pretty much okay, something that happens to the saphenous veins. What are varicose veins? Mainly it's okay that the veins swell up. Okay. Now, there's no compromise on the basics, because why would the veins swell up? Mainly because the veins generally have a weak wall. So the increased weight or pressure of blood in the veins mainly as okay will be able to cause the veins to easily dilate. And if that dilatation as okay is persistent, ultimately as okay the veins become weaker and weaker and weaker, and as okay becomes what you call varicose veins. Did that make sense? Now, back in the days, what they mainly as okay would do in case of varicose veins was physically as okay rip them out. Pretty much okay strip the patients of his or her saphenous veins. Did that make sense? Nowadays, they don't do that much, or they don't do it that way. What they mainly as okay do is that they inject okay as what we can call as okay a fibrosing substance, a drug that actually going to cause the veins to collapse and stick together, or I say the walls of the veins to stick together, and okay as in that way as okay the patient is now not going to be bothered anymore by the saphenous, or as okay saphenous varicose veins. Did you guys get that? Okay, so the superficial venous system mainly is okay just is an accessory venous system that we have in just okay our extremities. Okay, did that make any sense? Now ultimately as okay your short saphenous vein, well, whatever blood it was carrying, well okay as it will finish off by emptying, or as okay meeting the popliteal vein. And your long saphenous vein ultimately is okay will empty into the femoral vein. Did you guys get that? Okay. Now with that said, just last thing, let's do it this way and say, well, okay, yes, oops. Sorry. I don't know, sometimes it does happen. Like to play this game with me. We can say it's okay if this here is okay was skin. We can say that we had a saphenous vein. We can say, okay, deeper to the saphenous vein will be, that's okay, some muscles. And meaning is okay, we can say it's okay, deeper to that will be a deep vein. Clear? Okay. That makes sense. That just okay, that this is okay, yes. Ultimately it's okay, become, let's say it's okay, the popliteal vein, for instance. Or we also know is that okay, ultimately it's okay, this saphenous vein here is okay, will empty. So say we say, okay, completed vein, we can say this will have been is okay, the short saphenous vein. But, with that said, there's actually going to be veins or blood vessels that goes like this. Okay, and mainly as okay creates a connection between the superficial vein and the deep vein. Okay, and these are going to be referred to as perforators, or some people may even call them the perforating veins. Or what are they? Mainly as just connectors between the superficial venous system and the deep venous system. Okay. Did that make sense? So guys, at some point, yes, okay, you may look at your superficial veins and say, well, okay, I just saw them. Where are they? Well, physically, yes, okay, they are still there. But right now, yes, okay, they are not filled up with blood. Okay. And then it's okay, later on, you see it's okay that your superficial veins are distended, visible, etc., etc. And that's mainly because they are filled up with blood. Okay. So some of that blood that is okay, either fills up your superficial veins, is delivered to them via the perforators or the perforating veins. Or likewise, that's okay, blood from the superficial veins may go from the superficial veins to the deeper veins through these perforators as well. Okay. Most likely, that's okay, a reason where your superficial veins will collapse or will be invisible, will be, yes, okay, what you can call it, okay, not filled up with blood is when a person is what you can call shock. Have anybody heard of shock? Not a psychological shock. Never heard of something called shock?
Isn't it like you can go in septic shock?
Okay, septic shock is the type of shock, but very good. Okay, and what caused the person to go into, yes, okay, what you call septic shock? Sepsis, infection, right? So shock is mainly, yes, okay, that, well, okay, yes, your vascular system or cardiovascular system is not able to, because it's okay, maintain a high enough blood pressure to, is okay, pertain, yes, okay, the functions of the body. So if that shock isn't treated promptly, it may turn into, yes, okay, a big disaster. Okay. So, yes, okay, ladies and the gentlemen, in many cases, it's okay, where people go into shock, it's going to be, yes, okay, a nightmare to pass an IV line. Because IV lines mainly are going to be passed into your superficial veins. That's why it's okay, they may go here, they may go here, they may go here. But if the patient go into shock, that's okay. Those superficial veins pretty much okay collapse. Why? Because most of the blood is being directed from the superficial veins through the perforators to the deep veins. Did that make sense? So that's okay. If you can't see the vein, well, okay, how are you going? Sorry, not you, but how is it that somebody will be able to just okay pass an IV line? And that's again last thing. Okay, now of clinical importance, we may talk more about that when we get to our next program. But they may use as okay the large saphenous vein to pass okay as a big IV line. Okay, and that is going to be done right by your malleolus. Which malleolus? The medial malleolus, because that's where you find the large saphenous vein. On which side of the medial malleolus? On the anterior side of the medial malleolus. So that's okay. But yes, guys, Bavaria was okay through the deep veins. Will become as okay, popliteal vein just continues up, become femoral vein just continues up, become the external iliac vein. Okay, which means as okay will be joined by the internal iliac vein and form the common iliac veins. Did that make sense? And the right and left common iliac veins, what will they do? They will join and become the inferior vena cava. And as the inferior vena cava runs up next door to your abdominal aorta, it will receive other branches from other structures. But we'll talk more about that when you guys come back after your lunch break. Okay? So would it be fair enough that I see you guys back at 12:45? Okay, and let me just send you guys just okay your emails for your arterial supply and venous drainage of the lower limb. Okay.
Are
Thank you.
the perforators, are those in the upper as well? Or no?
Yeah, but they're more pronounced in the lower extremity. So that's why I mentioned them here. Okay, yeah.
Okay.
No problem. Okay, guys, welcome back. Now, guys, any questions? Okay, guys, so what did we just finish off with? We said femoral vein. Now, once it passes that inguinal canal, becomes the external iliac vein. External iliac vein is going to be joined by the internal iliac vein. And become common iliac veins. And we can say it's okay. If we have a right common iliac vein being joined by a left common iliac vein. That will form what we call the inferior vena cava.
Sorry, where did you say the inferior iliac vein that stems off of oh sorry, the internal. It stems off of the common iliac vein, right?
No,
Oh,
they will meet. They meet now, my dear. Listen, we are talking about veins. So right now, the blood is going to be flowing in this direction.
mhm.
Right? When we talked arteries or as okay, abdominal aorta or aorta, blood was flowing in this direction. Did that make sense?
Yes.
Okay. So here we can actually say that, okay, the internal and external iliac veins come together to form the common iliac veins. And we have a right common iliac vein, we have a left common iliac vein. When those two come together, mainly as okay, that's going to be as okay, we can say, form the blood vessel that we will refer to as the inferior vena cava. And ultimately, this inferior vena cava here is going to end up in the right atrium of the heart. Did you get that? Okay. So back in the days when I introduced you guys to yes, okay, what we call the inferior vena cava, what did I say? That was mean that's okay, going to drain blood from your leg, from your pelvic organs, and yes, okay, your abdominal organs. Did that make sense? Okay. But what it mainly is okay is going to be is okay, this is all going to be venous blood. Okay. Now, so we can mainly say, okay, what this will receive, yes, okay, we can say, yes, okay, will receive structures such as the gonadal veins. We may even, yes, okay, not even, we will also receive renal veins. Right, okay. We can even say, okay, we will also, okay, receive suprarenal veins. I gotta, just give me a second. So, guys, what this mainly will be is, yes, okay, what we can refer to as, okay, the systemic venous drainage of abdomen, pelvis, and it's okay, lower extremity. And why is that? Mainly because, guys, we're going to, yes, okay, have another venous system that we call the portal hepatic, because it's okay, venous system. Now, before I talk a bit, it's okay about what this system is or how this system is going to be made. Just think of the liver. Now, I briefly mentioned that point when we talked about the liver and the digestive system and saying that that was going to be the major metabolic organ of the body. Okay, which mainly meant that, okay, all the nutrients okay, that were absorbed from the alimentary canal, or what we call the gut, first has to go through the liver. Okay. So your liver is going to have this accessory venous drainage system. Okay. Now, if you look at, for instance, okay, our alimentary canal, If we just take a look at that. Okay, we can say, okay, we have the alimentary canal. Okay, in the alimentary canal wall, meaning that's okay, what you just consumed as food or whatsoever, the nutrients. Now, what did we say? Or what did we talk about yesterday? That we had, friends, yes, okay, arteries. Okay, coming up from, yes, okay, your superior mesenteric artery, inferior mesenteric artery, and all that. Okay, now those arteries, that's okay, what were they going to do? Yes, okay, deliver, yes, okay, substances, yes, okay, through the structure of the gut, to the structure of the gut, the wall, that's okay, the muscles, the fascia, etc., that you had in that. But another thing that it also would do, and that's going to, yes, okay, as I've been keep on saying, yes, okay, that's going to happen at the capillary level. That, okay, as the nutrients from your food would be absorbed into the blood. Ultimately, yes, okay, this blood here, yes, okay, have to leave. And that's going to leave in veins. Which for me, yes, okay, just can say will be, yes, okay, there. Ultimately, yes, okay, end up in what we call, yes, okay, the superior mesenteric vein, inferior mesenteric veins, etc. Okay, but that blood ultimately, yes, okay, is going to be drained through the liver, through this portal hepatic system here. Okay, and after that, okay, because you can say mainly say that, okay, as physically, yes, okay, this is where the liver is. So yes, okay, the liver is going to receive this portal hepatic, or these portal hepatic veins. But ultimately, yes, okay, that portal hepatic venous system is going to drain, or empty into the inferior vena cava. And that's how I mainly said that, okay, yes, any organ from the diaphragm and below are going to be drained to the heart via the inferior vena cava. Did that make sense? Okay, but there is going to be this additional venous drainage system to the liver, which we call the portal hepatic, or portal hepatis, or portal hepatic veins, or so and so. Okay, where is that going to be formed from? Primarily as, okay, blood vessels or veins bringing blood back from the gut. Okay, and what is it that blood is going to be? Well, okay, it's going to be low in oxygen, but it's going to be loaded with nutrients that the blood has absorbed as it was transfusing through the gut. Did that make sense? Okay. So before that blood can become as, okay, a part of, okay, as your general systemic circulation, it has to go through the liver first. So that's going to be delivered to the liver through the portal hepatic system. So the liver actually is a unique organ in the sense that it has two venous drainages. One through the inferior vena cava, because the inferior vena cava is going to pass through the liver, just structurally. Okay. But it's also going to drain through the portal hepatic system. Did you guys get that?
I have a question. The
Mhm.
systemic venous drainage, so your renal veins are located in that, correct?
Yep.
Okay. And then okay. Thank you.
Or we can mainly say that, okay, as your renal veins, if that's what you want to call, say, while going just, okay, drain into the inferior vena cava.
So before the abdomen, so before it enters into the inferior vena cava, it has to go through the liver,
The portal.
like the
Portal
portal.
hepatic. Yeah.
The veins have to go through the portal before it empties into the inferior vena cava.
Okay, listen. Justine, I don't know whether you're not PAing or what. The portal hepatic system is a second venous system. That primary SOK is going to SOK be directed to the liver. Okay. Roughly speaking, SOK, where would that portal hepatic system mainly SOK be derived from? The veins bringing blood back from your alimentary canal. Okay. But, before your inferior vena cava leaves the liver or passes through the diaphragm, the blood that has been brought to the liver via the portal venous system will still empty into the inferior vena cava. And in that, through the inferior vena cava, be brought back to the right atrium of the heart. Did you get that?
Yes.
Good. Now let's just try to, yes, okay, make this portal venous system, or what they also call is, okay, the portal hepatic veins. Now, guys, just to start from one side. And if we say it's okay that this is the spleen. Now, what did we say yesterday that the spleen is okay received? The splenic artery. Okay. Okay. Now, guys, this is not exactly the opposite of your inferior of your yes, okay, unpaired branches of your celiac trunk, or sorry, what the hell call that fellow? Abdominal aorta. Okay. But on the other hand, we can say, okay, now since the spleen gets blood, that blood is okay will also need to leave the spleen. That's going to just okay leave the spleen through it's okay what we call a vein that drains the spleen. So that's going to be referred to as the splenic vein. Did you guys get that? And ultimately, yes, okay, up here, yes, okay, we will have the liver. So in the splenic artery, yes, okay, blood flows through the spleen. In the splenic vein, yes, okay, blood is leaving the spleen. Now, what this splenic vein, yes, okay, will do is that it will receive a vein. And this vein here is going to be referred to as the inferior mesenteric vein. Now, just to, okay, make a long story short. Okay, because this vein, yes, okay, is going to drain blood from the structures that was supplied by the inferior mesenteric artery. So the structures that were supplied by the inferior mesenteric artery okay, that blood needs to, okay, return back or flow back towards the heart. So that are going to, yes, okay, be, yes, okay, through what we call the inferior mesenteric vein. So you can say, okay, you had a sigmoidal artery, you have sigmoidal veins. You have left colic arteries, you have left colic veins. You have superior rectal arteries, you have superior rectal veins. Did that make sense? Clear? Okay. But what we could say is, okay, the difference here is, okay, that your inferior mesenteric artery directly branch off the inferior vena, abdominal aorta. But the venous counterpart of the inferior mesenteric artery is going to be the inferior mesenteric vein. Is not going to, okay, directly meet the inferior vena cava. But it's going to empty into the inferior, now into the splenic vein. Did you guys get that? Okay. So now we can mainly say, okay, just the union of these two veins here. Yes, okay. A blood being brought is, okay, drained by from back from the spleen and from the structures of the hindgut is going to proceed like this. Okay. And as they go, Diego, go. Okay. What they will be joined by is going to be another vein. And this fellow here is going to be called the superior mesenteric vein. What do that do? Mainly as okay, receives similar name veins from all the structures that was supplied by the superior mesenteric artery. So jejunal veins, iliac veins. Clear, okay? Veins are turning back from this, okay, your inferior pancreatic duodenal vein. Okay? Appendicular artery, yes, okay, then appendicular vein, etc., etc., left colic veins, no, sorry, right colic veins, etc., etc. Did you guys get that? Okay. And now what do we call this? All these veins is okay coming together. They will end up forming as okay what we call the portal vein. Okay. Now what this portal vein is okay will receive is going to be as okay what we can call the gastric veins. Okay, and of course it's okay that's going to be it's okay right, and we can say it's okay left. So mean it's okay just vein it's okay venous occurrence, yes, okay, the right gastric artery and right gastric vein. That's okay, will join, become the gastric vein, which drains into the portal vein. So it's okay, blood that has been supplied to the stomach will get back via the right and left gastric veins. Okay. They join to become, yes, okay, a gastric vein draining into the portal vein. Now, ladies and gentlemen, okay, sorry. But we can mainly say that, okay, yes. Sorry. Okay. And okay. This here is okay, was our liver. This portion, this portal vein here is going to be as okay, what we call the portal impedance. Okay. Now just one last vein that it will receive. And it's not really a vein that is, well, okay, much active. And now, what we call that the umbilical vein. As a matter of fact, it's okay, this, okay, the left branch of your gastric vein, yes, okay, will also receive esophageal branches from the overland of the esophagus. And we may talk a little bit about these. Let's see. This one here will be important. This one here we will talk a little bit about. And okay, yes. But in all this, that's okay. We also had this other venous system, which was our. That's okay. Inferior vena cava, which means okay, it just passes through the liver. Okay, but ultimately, it's okay. This portal hepatic system, after passing through the liver, ultimately, it's okay. Empties into or mixes with the blood being drained by the inferior vena cava, okay, which brings blood just okay back from organs like the kidneys, the gonads, the suprarenal glands, etc., etc., etc. Further down, well, okay, yes, the internal iliac arteries or iliac veins, which drain as okay, structures in the pelvis. And now these is going to be as okay, what we can call the anal veins. Which we just can see will be of okay as a slight importance. Now, guys, in case of liver disease, okay, which could either have be something like hepatitis, especially that's okay if that hepatitis gets chronic, which we'll call this okay cirrhosis. In extreme cases, okay, this can lead to as okay liver failure. Or as okay, we talk about as okay liver cancer. Okay. Some of those instances. Now, ladies and gentlemen, you may not like to eat liver, but have you ever seen a liver? Why not spongy, but it's a pretty much okay, flexible organ, or you can say it's okay, accommodating. Okay. What mainly happens in most of these conditions that I mentioned? Swelling. And what that swelling is going to do, or yes, okay, we say, okay, a mass or a tumor is going to just, okay, press up against the vessel walls of the veins, which are weak vessels when it comes to, yes, okay, sustaining pressure, because they have a thin wall with thin layers of muscles, so not really much biceps. Did that make sense? So that actually makes veins easily compressed. Did you guys get that? Okay. So what's going to happen when the veins are pressed? The blood flow through the veins is going to be sluggish or slowed down. Or in the worst case scenarios, okay, pretty much close to yes, okay, non-existent. And what do we have then? That's mainly going to cause that there actually is okay will be a backward flow mainly because the flow in this direction here is sluggish. That there's going to be more and more pooling in the veins. Now let's just go down here and say it's okay. Let's make all of these veins here is okay, may pool up with blood. And that's what we commonly call a hemorrhoid. The umbilical vein, well, okay, pretty much okay as a vein that okay has worked a lot when it's okay when we were smaller or younger. But it's okay here, it's okay, they may, it's okay, distend. And we actually has okay what they call is okay that phenomenon known as Medusa's here ahead. Or they also has okay call it spider nevi, which means okay spider's net. Clear, okay. In the esophagus, now guys, if you say that okay, the lower end of the esophagus, actually it's okay. Well, it's going to have an arterial supply, but there's also going to be as okay veins. And if the blood flow through the liver is sluggish because of something like any of these conditions here, what's going to happen? These veins may start to dilate. And ladies and gentlemen, it's okay when they pop, that's mainly going to be as okay where the patient will vomit fresh blood in his or her vomitus. So mainly as okay, two reasons why a person may as okay throw up fresh blood. I say throw up, not cough up. If you cough up fresh blood, then you probably has problem with okay, as your earways and so and so. But throw up fresh blood, it's either because of okay, as these varicose veins in the esophagus, or what they actually are just called esophageal varices. Did you guys get that? That popped and bleed. Did that make sense? And the person will throw up blood. Or God forbid, yes, okay, if he or she had esophageal cancer and that tumor may, yes, okay, just rupture into the esophagus and okay, starts bleeding that way. Did you guys get that? So what I back in the days when we talked of the chambers of the heart and the blood that they received, said that inferior vena cava enters into the right atrium and it drains blood back from any structure below your diaphragm. That would not be wrong. Did you guys get that? Okay. But the system here is a little bit They are different from other areas of the body because of the accessory venous system that we had, which was the portal hepatic system, which primarily brings blood back from structure that was supplied by the superior mesenteric artery, inferior mesenteric artery, and or your celiac trunk. Those veins are going to form this system called the portal hepatis, which goes through the liver. Okay, mainly as brings the goodies back so that they can be finally metabolized, and then be delivered to the body. Did you guys get that? Any questions? Okay, guys. Then what was another structure that I talked about? So we said this was the right atrium, and we said that the right atrium received the inferior vena cava. And we just showed us, how that inferior vena cava was formed. Exactly. Now, another vena cava that's going to just, open into the right atrium was our superior vena cava. And ladies and gentlemen, what did I say about the superior vena cava? That it was going to drain blood from the upper extremities. From your head and neck. And we can say it's all the structures within head and neck. Clear? Okay. Now, what we knew from, let's say, it's the left side. Let's just say it's we had the right ventricle. Okay. What did we have here? Subclavian artery, common carotid artery. We said that we had brachiocephalic trunk, which was going to give off common carotid artery and subclavian artery. Now, guys, the other day when we talked about the extremities, the venous drainage of the upper extremity, what did we say? We ended the discussion at what we call the subclavian vein. And that's going to be a subclavian vein coming from both sides. Okay. Yeah, okay. What drained into the subclavian veins? Were the axillary veins. Okay. That axillary vein was met by the superficial vein that we call the cephalic vein. That axillary vein, or those axillary veins, actually were continuations of the brachial veins. Okay, where the brachial veins had received what we call the basilic veins. Okay, where we mainly can say that yes, this brachial vein was just the union of the radial vein and your ulnar vein. Okay. Did you guys get that? Okay. So we can mean that this is what was going to ultimately become the subclavian vein, which were responsive as was the final vein that will bring blood back from your upper extremities or your arms, forearms, hands, fingers, etc., etc. Did I make myself clear? Okay. Any questions? Now, guys, just a last, because I know that, yes, that we said, we had common carotid arteries that was going to become a split into, the external carotid arteries and, the internal carotid arteries. Okay. But guys, here there's going to be a slight name change, because for the carotids, we do not have something known as carotid veins. So the venous equivalent to the carotid is going to be what we will call jugular. But guys, it would not be wrong to say that we have an, let's say that we have external jugular veins, being joined by what we can call the internal jugular veins that forms what we call the common jugular veins. Did that make sense? So although it's okay, there will be it's okay vena comitantis through the carotid arteries, whether it's the external or the internal, or the common carotid arteries, but they are not called the carotid veins, but going to be referred to as the jugular veins. So just last one thing, guys. So we said, sorry, we can say it's okay. Now this is going to be it's okay, all right, atrium. We said so far we had the right and the left subclavian veins. Yep. Okay. Now we have what we can call the right and left. Sorry. Common jugular veins, which means okay, were formed by the union of the internal jugular veins and external jugular veins. Did you guys get that? Now, guys, so your common jugular veins on both sides. You can say left and right will join with the subclavian veins on the right and left. Is that clear? And the union of your jugular vein with the subclavian veins is going to be what we will call the, or is going to lead to what is going to be referred to as the brachiocephalic veins. So as a matter of fact, we actually have not just one, but two brachiocephalic veins. Where there's going to be a right brachiocephalic vein and a left brachiocephalic vein. Did you guys get that? Now, how many brachiocephalic trunks did we have? Yes, Nicole. How many brachiocephalic vein or trunks did we have?
I am looking through my notes.
Okay. Anybody?
Is it not just one?
Huh?
It's one?
Just one. Where did that brachiocephalic trunk come from?
The aorta?
The aorta. What did the brachiocephalic trunk give off?
The carotid, the right carotid and the right subclavian.
Right subclavian. Okay. But what do we see? That on the venous side, the subclavian on the right is joined with the carotid equivalent, which is the jugular or the common jugular, to form the brachiocephalic vein. But that's going to happen on both sides. So it's okay, both your right subclavian vein will join with the right common jugular vein and make one brachiocephalic vein. So is your left subclavian vein going to be joined by the left jugular vein to make another brachiocephalic vein. Did you guys get that? Okay. And what mainly happens is that when this right brachiocephalic vein joins or meets with the left brachiocephalic vein, that forms your superior vena cava. And where does that empty into? The right atrium. Right, okay. So what I said back in the days, that your superior vena cava was going to just, okay, drain blood that return back from your upper extremities, from your head, your neck, and all the structures within that, or within your head and neck. All that blood, when it returned back, it was going to empty into the heart through the superior vena cava. Did you guys get that? Yes, guys. Did you guys get that?
Yeah.
Good. Now let me just ask. What structure will empty into the right subclavian vein? And what structure will empty into the left subclavian vein?
Can you repeat that?
Huh?
Can you say that again?
Why would I do that?
Okay.
And it's not your axillary vein. Let me just make that clear. What will empty, or what structure will empty into the subclavian veins on the right and left?
Was it the ducts?
Which ducts? Go ahead, my dear.
I guess the left lymphatic duct would empty into the left subclavian vein. Is that right?
Mm-hmm.
And then the right lymphatic duct would empty into the right subclavian vein.
Exactly. Here we go. Now, what is going to be emptied via these ducts?
Lymph.
Huh?
Lymph.
Lymph, exactly. So when I said that back in the days, that ultimately, yes, okay, lymph will empty into the blood. Here we go. So that was your superior vena cava and your inferior vena cava. Clear? Okay. So that's okay. Some similarities, but some slight differences. Two, that's okay. The arterial supplies and the venous drainages. Okay. Please, guys, make sure that you know that we only got one brachiocephalic trunk. And when we say trunk, there is always going to be an artery. Brachiocephalic trunk branches off aorta. But we've got two brachiocephalic veins. What makes up the brachiocephalic veins? Well, okay, on one side is going to be that side's jugular vein meeting the subclavian vein. And so on the other side. That side's jugular vein meeting a common jugular vein meeting the subclavian vein. And it's going to be the union of your two brachiocephalic veins that forms the superior vena cava. Clear? Okay. Or be the vessel that drains blood into the subclavian vein is going to be the axillary vein that receives its blood from the brachial vein, that receives its blood from the ulnar vein and radial vein. Okay, guys. Now that was all that I could offer. So if anybody has any question, the time is now. And now is the time. Okay, guys.